It is the health center 3. But operations, when you see operations here, we do exactly health center 4 work. Catchment area has a population of about 7,800 people. Then we also receive patients from Congo. You know, there is now Congo, our neighbor, Congo. Then we have a town council, Paidha, well across about 4 miles away. So they also come here. They prefer to come here. Then we have at least in a month between 600 and 800 outpatient attendants.
So you are connected to the grid?
We are connected to the grid. With the electricity, we are connected to the grid. Of late, it has been working very well, 18 hours. So when it starts at 6, it lights up to midnight. So when it is off, we change our fridge here to gas. Then it is continuous. The following morning, we remove the gas, we connect back to electricity. This one is a solar energy for fridge. It was brought by UNEP program. So this solar is supposed to have a fridge, to use a fridge there for storing our vaccines. But now currently it is spoiled. So the district has given us another fridge which uses gas. We shall see it also there. Then we have these ones. You can see the panel here. They were supposed to be for recharging lamps, but the lamps now are spoiled also. So this is one source of power we have here, solar. Yes. This fridge has been working very, very well. It uses solar. We saw the panel outside there. But now the problem is here. It's spoiled. And the battery is now gone. That's why it has not been working. Then we have the other panel we saw, which charges this. So we have a fridge here which uses gas. We keep our vaccines here. Mm-hmm. We keep our vaccines here.
Can I open it? Can you open it? Okay.
Can you see? So here you will see 2 sets of sterilizers. There is this steam sterilizer which uses charcoal. Then there is this sterilizer which uses strictly electricity. This one they use steam. You put some water inside there, then the water boils inside there. So this is our laboratory. This is our laboratory. We have a fridge here for storing some drugs. Then it uses both electricity and gas. When there is electricity, it is run on electricity. When the electricity is off, we switch to gas. We have the microscope, electric. This is electric. It uses electricity.
So what do you use the microscope for, especially?
We use it for various examinations, like stool examination for intestinal parasites, examination of blood for malaria parasite. This one here is what we call the centrifuge. It helps us to obtain serum or plasma whenever we want to do any test on blood samples.
One of the original lamps they brought, you see one is surviving here in the laboratory. It is charged by... There are 2.
The other one is on the other side.
They are charged by solar system. You see it is being charged. So when electricity is not there, they can use this in the laboratory.
We use laboratory registers, and any information tapped from the laboratory register, then we transfer to the computer for further records.
How would it affect the hospital if you did not have computers and printers?
It was a lot of labor. We used, like ruling, we used to do manual like these, writings, a lot of writings, and we would go late. Now compiling maybe something for the month, it would take us sometimes into the new month. But now as we go, we keep on putting, at the end of the month, the figure is already there. Yeah, so it is really assisting us. Yes. We need power here constantly. When there's no power, we are idle. When there's no power here, we are idle. That's why we really cry for our power to be constantly.
What is it?
This is communication line. We communicate in the whole district. So it is put directly in word where it will always be used. We communicate to the district. You can communicate to other units using radio call. It is a radio call system where you can call to these units. Only in the health sector. It doesn't go in other places, only for health centers and hospitals.
And it works with the solar?
It works with the solar. You can see the panel there. It uses solar. It is supposed to be used the whole day. It's supposed to be used the whole day to report some emergencies, some informations. You can pass through this information through this system. Yes. So this thing uses strictly electricity. When there is no electricity, the thing is idle.
So you're saying it works very well?
It works very well. It has sensitized people in this area. Now they are aware of family planning. They are aware of dangers of casual sex. They are aware of large families. They are aware of dangers of polio, dangers of TB. When we don't have electricity here, there are these lamps. There are these lamps Sister was talking about, the rechargeable lamps. We put them here to be used, because there we really need bright light. So we use those rechargeable lamps and put them inside there. So then in absence of that, then we use a hurricane lamp.
But these ones are also used, the kerosene.
These are, yeah, the kerosene. Sometimes the electricity is only for 5 hours. Then they can go up to 18 hours. So it is not static. That's our problem with the electricity. Otherwise it is a very good source of energy. And then with the solar, the equipment have been breaking down. Otherwise it was working very well. We also think again that we are depleting our trees in our environment. So if we had constant supply of electricity, maybe we would buy heaters, then we use for heating our tea. Otherwise we are using charcoal to heat our tea.
What about the prices of the electricity?
Electricity started humbly very well. They were humble, and then when time went, it has become so expensive now. Now here we pay between 150 to 200,000 per month, which is very expensive for us. When we go there to complain how they are charging, they will not tell us frankly that we charge you because of this and this and this. But we find ourselves paying huge amount of money. Yes.